So hi, now I am in Dunfermline with Miranda who runs the Aesthetic Spirit Clinic. And you've been in aesthetics for about 15 years,
That's
haven't
right.
you? But you came into it a really interesting way because you were training surgeons in how to use this robotic operating.
It was
surgical.
It was robotic surgery, and it was £1 million piece of equipment. And in order to successfully be accepted as a new technology, you had to make sure that everybody was confident in what they were doing in the roles, and during life surgery.
Yeah.
So I absolutely loved that role, and with the industry in aesthetics being quite unregulated, I took the same attitude and wanted to be as best a kind of practitioner as I could be.
So you've trained up through, what are all the things you were telling me you've
done?
So
I've done my graduate diploma from Greenwich, the University of Greenwich. I've done my postgraduate from the Northumbria University up to master's level, and also my prescribers, a nurse independent prescriber in aesthetic medicine.
And then all these years of experience, which I think is really the key thing in learning how to make those techniques that you've learned really work in a way that your patients love. Now you were telling me you're a real expert on getting the natural look. Well, you weren't telling me, I was deducing this because up here in Fife, quite a few of the people are quite cautious about moving forward to treatment. You see, they're not going to tell their husband or whatever, but you clearly managed to treat them in a way that there's no giveaway when they go home.
So it's an interesting kind of path into coming through the door. So a lot of people have been thinking about having treatments for a long time, looking at what practitioners they can go to, what it is they want to achieve for a natural outcome. And the message that seems to be consistent is nobody likes the aging process, but very few want to look different. And so the way that we like to approach it is that we don't want to make anyone look different, we want to stop the aging process. And
brilliant. So you're going to keep them as they are?
As much as possible.
Yes. Totally. Well, that's it, isn't it? Because that's people's huge fear, isn't it? That they think they're going to look like something monstrous if they step anywhere near a needle. Yeah,
and it's a big step, as we say, to come in for a consultation is a big step. There's no commitment obviously to go forward for treatment, and it's very much an information gathering experience. But for people then to understand that all we're doing is replacing their lost volume, anything like that, and not overdoing treatment, is what they are really reassured about. And that's what we aim. And it's not just with dermal fillers and Botox, it's with different modalities of treatment as well.
Yeah, because you were saying you treated one patient for the plasma,
the non-surgical
blepharoplasty. Yes. And I know that leaves quite a sort of crusty pattern of little scabs, is there? But her husband didn't even notice. I don't know how she explained it away, but you would say people will find a way to explain the treatment once
if they really want the treatment, if they understand, what is involved in it, and they want to achieve the results that we have discussed realistically, because that's the other thing. It is about being realistic, not over-promising, because you want happy clients. So if you're not doing what you have agreed with both parties, then once they realise what can be achieved, then yes, they'll find pretty much any excuse to go.
Now, talking about being realistic with things, we're going to talk about lips and how you have clients who will walk in and say, I want half a mil, I want 2 mil, but and how incredibly important it is you listen to your practitioner, because what you think might be right for lips may not be right at all. I mean, surely it depends on so many factors.
There's been numerous clients who have phoned up and said, as you say, I want this amount to achieve this. And it was only actually yesterday I had a client who said, right, how much do you charge for 0.5 mil? How much do you charge for 1 mil? And I found myself explaining that it is not until, number one, we have that consultation about being realistic, and secondly, because it's more of an artistic approach, you have to see how the client's tissue takes the dermal filler, what shape they are, and what we can agree. And it's not about a phone call to say, how much am I going to have for this? Because you wouldn't really go into any other treatment in any other speciality saying, which product are you using for this amount, and put a financial kind of figure on it. There's so much more involved.
Yes, and once you've had that chat, people will understand about how you've got to take account of their lip shape, their existing lip volume, keep it all proportional.
Yeah.
Yeah.
And I think it comes from, as we were talking about a little bit as well, there is a trend for particularly young women to have very augmented lips.
Yeah.
And there's probably that conversation on the street, which is I had this amount for this price. And so people are sort of adding, making sense of it that way and approaching it from that way instead of an artistic approach.
Yeah. But you've obviously in this area got a very keen clientele, which is really interesting because you're well separate from the sort of Glasgow and again from Edinburgh, but you've got a lot of people around here who are finding their way to you rather than going there, which is
absolutely
great.
Yeah. So people that have when they come in, they say that they would spend X amount of time going into Edinburgh or into Glasgow. There are many more practitioners there.
Yeah.
And when they have done their research and found us here, there's a wide reach on this side of the bridge. Saying that, from having worked in Edinburgh, we also have people coming.
From Edinburgh
back up here. Yeah,
well, that's
so
a nice tribute.
So it's definitely a growing area for sure.
Yeah. Fantastic. Well, thank you so much for your time and for seeing us. It's great to meet you.
Yeah, lovely to speak to you.